All right. Good afternoon, Senator.
Good afternoon. Thank you, Madam President. And I wanted to again start by thanking all the staff. I've taken my mask off. The reason is we are 6 feet away from each and every individual. Each mic is cleaned up. So we are obsessively making sure that all the staff and all the senators stay well and healthy. And this is what this bill is about as well. So, Madam President, I stand in support of amended Bill 600, HB 6001. I want to start with two words, access and safety. And then when this pandemic had impacted us in our state, on the 19th of March, our governor had Executive Order 7G. This executive order has saved many lives. This executive order has saved a lot of money for our state because at that very critical time, every single day there are patients who are actually getting sick for non-COVID related issues. And then there was a reason and there was a need to have an immediate management of those patients that needed to be continued. Some were in the process of having their blood pressure, hypertension, diabetes, cancers, all of the, you name the condition, they were being managed for that. And with this specific executive order, we were able to have the continuation of the access without putting the safety or jeopardizing the safety of our citizens. And I think this executive order, as I said, has truly helped many of our citizens and continues to do so at this time. Now, it's important to try and stay the course and make sure that if there is a second wave, that we have a plan of action in place, and we need to also make sure that we codify this at least till a certain time that we feel hopefully safely that we'll be in a better place from the pandemic perspective. And I think this bill does exactly that. So I wanted to thank my colleagues who have been leaders in this effort, Senator Lesser, for your strong work, and I know Senator Abrams has been working with this as well. I think what we have learned in the last few months from this have been a few things which are very important, and one of them is that there is a digital divide. The digital divide is very real, where people in our community do not have access to the technology, where their access to telephone services is poor with the cell phone services, and then there's unfortunately capacity to manage the smart devices is the other issue that we have noticed. So our seniors and some of the community members with needs, they have not been able to use the high-tech, if you will, video conferencing, telehealth things that we have been using, and they have been dependent on a telephone line to be able to manage this. This actually addresses that issue as well, because the caregivers have been taking care of them as expected in the best way possible, and this will actually make sure that there's parity with respect to a telephone call that is going to be made to the patients. And again, let's be clear, the best care is going to be the care that is going to be in person. We know that, we recognize that. But there is an opportunity to try and make sure that in the absence of that best availability, we have a plan of action where we can provide the care with the same level of access, keeping the people protected. So I think we have to have long-term strategy, but this bill does and the sunset is on March 15, 2021, which is a very safe time, hopefully. And if we have to look at this in more detail, getting the data, having a long-term strategy is going to be very beneficial. I think this is going to save lives. This is going to continue to provide the access to our citizens, and this is going to provide safety as they're trying to get that access. I would urge all of my colleagues to join me in supporting this bill. And thank you, Madam President, for this opportunity.
Thank you so much, Senator Anwar.